Hello everyone. So today I'm starting another topic, that is reproductive health. As we know, reproductive health is just like any other health. Health is a state of physical, mental and social well-being. Similarly, this is here the reproductive health, which is dealing with reproductive health is one of the important part of the health which deals with the health of reproductive system and its related aspect. So it is also divisible into three parts, that is the physical reproductive health, mental reproductive health and social reproductive health. Let us talk about the physical reproductive health. As we know that the physical means that bodily, that is whenever anything is related to body we say is it physical. So physical reproductive health will deal with the functioning of the proper functioning of the reproductive organ. It stands for the health of reproductive system, means the organs of the reproductive system are working in a proper manner. Like in the male reproductive system, the testis is there, which is there to produce the gamete as well as for hormones. So if they are producing enough of sperms with the proper motility, proper viability, then hormones are produced in the proper quantity, then we says that the testis is properly working. Similarly, the ductus system is there, which is having vas efferentia, retitestis, epididymis, vas deferens and urethra. So if they are all open and they can inseminate the semen, then we say that the ductus system is also working properly. And the glands which are there, seminal vesicle, prostate and cowpers, if they are working properly, then we say that the male reproductive system is working in a proper manner or its health is okay. Generally what happens, somewhere either the hormone production or the duct may be blocked or something like that. So that is the improper male reproductive system. In case of female, the ovaries are there, which is to produce ovum, and the female reproductive hormone, that is progesterone and estrogen. Similarly, the ductus system is consisting of fallopian tube, uterus, cervix and vagina. If they are all open, generally what happens, the fallopian tube may get sometime blocked. So in that case they will not be able to transfer the ovum, or the sperm may not reach there. So that may be there, that may be one of the case. Okay, uterus may be not strong enough to hold the baby and miscarriages take place. That is again as some type of abnormality seen in female. Otherwise generally it is okay. So if all these organs and systems are working properly, we say that the physical reproductive health is okay. But several of these problems are developed by infections. Infections is again a very big problem, because this creates some type of abnormality, some type of inferences in the reproductive functioning. Okay, most of these infections are spread from unhealthy person to healthy person, infected person to healthy person, due course of sexual intercourse or sexual contact. So that is why they are known as the sexually transmitting diseases. Okay, these are known as the sexually transmitting diseases. There are several sexually transmitting diseases. These are the disease categories, these are the diseases, and these are the um, pathogens which are causing them. The first one is viral disease, AIDS. The causative organism is human immunodeficiency virus, one of the most dangerous disease because it doesn't have any cure. Another dangerous disease is here hepatitis B, which is caused by the hepatitis virus. It is also don't have any cure. Viral disease warts, which is caused by human papilloma virus. Then viral disease herpes, which is caused by herpes simplex. Bacterial disease gonorrhea, which is caused by Neisseria gonorrhoeae. Bacterial disease chlamydia, which is caused chlamydia. Then bacterial disease syphilis, which is caused by Trypanosoma papillidum. Then fungal disease candidiasis, which is caused by Candida albicans. Then protozoal disease trichomoniasis, which is caused by trichomnia. Okay, so these are the various pathogens. Now we are not here to study the medicals, so we are concentrating only up to the class 10th and 12th level. So only a few disease which is described here: the viral disease, the bacterial disease, protozoal disease and the fungal disease. Now one thing is very careful to be noticed here, that most of these diseases are transferred by means of the sexual contact, but that's not all. The disease can be transferred by the unhygienic conditions also. Like if suppose someone, not a good thing, but sometime what happens in the hostel and all, the children even the wear the undergarments of the other person. Now suppose the person's undergarment which he is sharing is infected, then he or she may get the disease. The washroom which is used by the common people, like in the hostels or in the railways or in other places, hotels and all, if it is not properly clean and the infected person sat before us and some droppings are there on the linings, and if we also got sit there, then it may be possible that we may get disease. The swimming pools, the towels, so these are the places where we can get these diseases even without sexual intercourse. So it is not necessary that they will always pass by the sexually transmitted or transmitted by sexual contact only. So one thing we, and another thing which we have to take care is that these diseases need not to show very clear symptoms. So most of the time these diseases are ignored because their symptoms are so poor, like the pelvic inflammation, the pain in the pelvic region, or some type of discharges. Now these are very common thing. The one can get pain because, see, if we talk about India, that toilets, public toilets are not easily available. Even if they are available, they are not properly hygienic. So generally what happens, the girls and women and all, they are generally avoiding to use toilets. So they are the thing, controlling urine for long time, and that itself causes the pelvic pain. Okay. Then some sort of discharges are always there. The pain may be there because of the excessive exercise, like long hours of standing. The teachers has to stand 3, 3, 4 hours together. There are some other job where the people have to stand for long hours, like receptions and all. So they may get these diseases, the pain in the pelvic region. So they may simply confuse with the STD or the normal pain. And the STD pain also, they will think that it is a normal pain, and this is how they are ignoring, and by the time they realize, it take a very severe stage. Okay. And if we not pay attention, if we don't treat it, then it may lead to the pelvic inflammation disease, or it may lead to infertility, or in severe cases it may even lead to cancer. Then how we can avoid sexually transmitting diseases? The very first thing is that is maintain proper hygiene, and the second is avoid sex with unknown person or multiple partners. Unknown person, if he, even if he is suffering from disease, he will not tell. Multiple partner, out of question. Okay. Second, always use condom. If unknown person out of the family, if somebody going outside, then one should always use condom, because he or she is not sure that the person whom he is indulged or she is indulged into sexual relation, whether he is having proper health or not. And third, in case of doubt, one should immediately go to a qualified doctor as soon as possible, in order to early detect and treatment. Because I just now I said the treatment will take long. Why treatment take long? Because see, the sexually transmitting diseases are see, any infection require three conditions for its proper maintenance. What are the three conditions? That is the proper temperature and moisture. Sexual reproductive system will always have proper temperature and moisture. Moisture will always be there. Some type of secretions are always there. Second, nourishment. So since some type of secretions are there which is containing organic substances, like mucus is there, the carbohydrates are there, fats are there, which will be sufficient for their survival. And third, there is no direct contact of antibodies, that is the blood, WBC and etc., to the this thing, because these are found outside the body, and then they are causing various type of severe problems. So that is why one has to start treatment as soon as possible, and as long as doctor says. Suppose the treatment, he says that it will go for 3 months, one has to be very carefully take it for 3 months. Okay. So this is it. Mental reproductive health. Now mental reproductive health is associated with the the hormonal changes plus outside whatever kind of people we are meeting with. So it is one of the most important and most ignored part of the reproductive health. People are generally not bothered about it. Okay. As we are aware that the adolescence is caused due to the changes in the hormonal levels, which is a root cause of this health. Because in this stage, 12-13 साल की उम्र में आते, till 13 years, as the child attain, he or she is feeling some type of hormonal changes, and these hormonal changes are very much different. So there they changes the behavior. During this phase, the emotional attitude changes. The person develop attitude of anger, rage, and other type of thing, experimentation and all. Okay. See, during this phase, the number of body changes take place and the person inclined to do new experiments. Now experiment can be towards the drugs, experiment towards the sex. Okay, so it is due to these changes we see the several events of rape, molestations and eve teasing. Now again I'll say that several people indulge in the drug addiction, and the last line, that is to avoid these type of things, high moral and the ethics have to be practiced. Now these are the things which are lacking in our society. We are not treating the females in the proper manner. Even at the home, the ladies, the female, the girl child, they are not giving the equal opportunity as the boy child. So that is why from the home only they are developing this nature that the girls are to be like they should not be properly treated. एंड जो अपने घर में अपनी बहन के साथ या अपने वाइफ के साथ या अपनी माँ के साथ में प्रॉपर ट्रीट नहीं कर रहा होगा, हाउ कैन वी एक्सपेक्ट ही और शी टू ट्रीट द अदर आउटसाइड पीपल इन अ प्रॉपर मैनर. ठीक है, द बॉयज एंड गर्ल्स आर नॉट गिवन इक्वल अपॉर्चुनिटी. यू कैन सी इन योर फैमिली, इन योर सोसाइटी. ठीक है, वन में हैव द सेम अपॉर्चुनिटी, सेम respect, same things to the both the sexes, but it is not generally in India. Okay, especially. So that is one of the cause. The social reproductive health. Social reproductive health is very important. Now the ultimate outcome of the reproduction is the childbirth. So reproduction is ultimately related to society. It is said that healthy reproductively population makes a good society, because as we have studied that STDs are the commonly causing from one person to another, both due to unhygienic practices and both secondly due to the STDs. And these are the things which are having a social stigma. So if person is having STD, he or she will not reveal it to the others. He or she may get even hesitant to go to the doctors, and then it is being transferred from one person to other. So if you remember, AIDS is most recent disease, like it is come in 1980s, yet now world over several millions of people are suffering from it. So you see that what you call quantum of the disease. Okay, one of the biggest problem associated with this social reproductive health is enormous increase in the population, because ultimately what happens if one is indulged into the sexual relation, there is a probability that a child will be born, and if the child is continuously being added, the population increases. Okay, रीजन ऑफ पॉपुलेशन एक्सप्लोजन, इंडिया ने तो देखा है पॉपुलेशन एक्सप्लोजन, whereas the world's population explosion is tripled in 100 years, India's population is tripled in 50 years. At the time of independence, our population was somewhere about 35 billion, which is now reached to 100, but in year 2000 it reached to 104 billion or something like that. That is, we have multiplied in 50 years 3 times, but world's population is multiplied 3 times in 100 years. So we are very rapidly increasing our population. What is the reason? Drastic increase in the population is due to decrease in the death rate. The reason is death rate. Initially, suppose at the time of independence, it was common that every family had at least 5 children. So that was required because not all the children used to attain the sexual maturity or attain the adolescence. Most of the children used to die at the infant stage only, because of the several type of diseases and no proper medical facilities and other things were available. So at that time it was required to have more number of children. But now, due to the several reasons, because of the medical facilities, better medications and sanitation and all, which we'll describe here, so now the death rate is drastically decreased and the birth rate is not decreased in same proportion. So this is leading to the enormous increase in population. See, at the time of our independence, the average age sustainable life expectancy was somewhere about 32 years, which has now increased to 70 years thanks to the medical facilities. Okay. Next is another reason for early age of marriage. In India, at the time of independence or even now, there are several tribes, several villages where the marriages are taking place at a very early age, somewhere about 13, 14, 15 years. And then they are starting reproduction from the age of 15, 16, 17. And by the time they attain 21 years of age, they are already having 4 to 5 children. So because the child is not that, see, this 13, 14, 15 is not an age where a person can understand, or you can realize that what will be the quantum, what will be the effect, what will be the bad effect of the this on population in the society. So that is one of the, due to better health system like reach of hospitals, laboratories, medicines, etc., death rate is greatly decreased. So we are studying that what are the reasons the death rate is decreased, but we are not decrease the birth rate. Birth rate is still going on. Like I'm talking about the early 50s, 60s. Okay, so that is why what happened. The death rate is decreased, but the birth rate is still high. So this lead to the increase in population. Better sanitation and availability of clean drinking water, because most of the diseases are caused due to the unclean water. So clean water पहुंचने लग गया लोगों घर में, sanitation, नालियां वगैरह बन गई. So now the diseases are not very common. Development of new vaccine and immunization, which also help in the decreasing or lowering the death rate. Okay, so like diseases like smallpox, which cholera, polio, plague, that used to clean the entire village. पूरा सुपड़ा ही साफ हो जाता, गांव का गांव खत्म हो जाता. सो दैट यूज्ड टू बी देयर. एपिडेमिक, सिवियर एपिडेमिक. नाउ वी डोंट हैव सच एपिडेमिक. ठीक है. द रिसेंट एपिडेमिक also we controlled within 1 year or 1.5 years time. The government of India introduced the family planning program as early as in 1951. Thank to that prime minister, first prime minister. He then only realized that if the population will go on increasing in this way, we will not be able to sufficiently provide food to everyone. That time the food was the biggest problem, because India was not self-reliant in the food. So we used to import food from other countries. So that was the first need, that population is to be controlled. तो aim क्या रखा उन्होंने? To check the infant mortality rate. बच्चे बहुत ज़्यादा मर रहे थे, 5 साल की उम्र तक पहुंचते नहीं थे. Not all children used to attain at the age of 5. They used to die because of tetanus, cholera, or whooping cough, or because of dysentery, or because of the improper diet, etc., etc. To check the maternal mortality rate, that most of the deliveries used to be performed at the homes. There was no proper hospital facility available. So the number of public hospitals were increased, government hospitals were increased, so that most of the people can reach there and the maternal mortality rate could be controlled. The tetanus vaccine and iron and calcium tablets, etc., were provided, taken to provide the care for the pregnant woman, the vaccination and the tablets and all. To provide postnatal care after even the birth of the child should be vaccinated. The mother should be this thing called, and she should be made literate that what are things to be done in order to maintain the this thing the continuity of a child and the mother. Provide vaccination and other facilities for the mother and child both. Government of India also took some of the steps to bring down the population growth rate by changing the marriageable age. जो पहले कितने थे, 13 साल, 12 साल. There was no rule only. What government did, it made marriageable age for women 18 years and for men it is 21. सुनने में आया, in next few years the marriageable age for even for the women will be made 21 years. तो इससे क्या हो गया, by the time 18 years the person little bit understand. And अब अगर वो population add भी करेगा तो कितना, 1, 2 या 3 बच्चे, इससे ज़्यादा क्या ही करेंगे. ठीक है. Putting a ban on the child marriages and making it a criminal offense, very important. और क्या किया, पॉपुलेशन कंट्रोल मेथड अब हम आएंगे. ठीक है. तो ऑल दीज वर द रीजन, बिकॉज ऑफ दैट द चाइल्ड दैट डेथ रेट वाज कंट्रोल्ड बट द बर्थ रेट वाज नॉट कंट्रोल्ड. सो नाउ व्हाट इज द नीड इज टू कंट्रोल द बर्थ रेट. तो बर्थ रेट कैसे कंट्रोल करेंगे? पॉपुलेशन कंट्रोल मेथड्स. देयर आर सेवरल वेज बाय विच द कंसेप्शन ऑफ अनवांटेड बेबीज कैन बी प्रिवेंटेड. जितना चाहिए उतना रखें, उसके बाद जो भी अनवांटेड है, दीज आर ब्रॉडली क्लासिफाइड इनटू फॉलोइंग टाइप्स. तो हमने इनको 5 टाइप में डिवाइड कर दिया. पहला नेचुरल मेथड, सेकंड बैरियर मेथड, थर्ड ओरल पिल्स, इम्प्लांट्स भी आ जाएंगे इसके साथ में, आईयूडीज, आईयूसीडी इज ऑल्सो it is commonly known as. And the fifth one is surgical method. Let us talk about them one by one. The very first thing is natural method. Natural method is based on the abstinence. किसी न किसी तरह से abstain करना है हमको. क्या करना है? As we know that the best time of ovulation is mid of the menstrual cycle, about 12, 13, 14, 15 और 16, और 2 दिन उसके पहले और 2 दिन उसके बाद तक का हम रखेंगे तो हम कह सकते हैं अगर 10th to 18th डे तक if somebody abstain from the sexual contact, then it may be possible that the child may not be born. But ये कोई पक्का तरीका नहीं है. Until unless someone is having a regular menstrual cycle of 28 days every month, then तो ठीक है, उस पर विश्वास किया जा सकता है. Otherwise this is not a reliable method. Withdrawal is again a method where most of the people are thinking that before insemination they can withdraw the penis and the insemination will be prevented, and this can also lead, but then this is also not a reliable method. Okay? Then the third is generally after the birth of a baby 3 से 6 महीने तक वापस menstrual cycle नहीं आता. The menstrual cycle occurs only after 3 to 6 months of the birth of a child. But this is again is possible or good for only those women who are intensely breastfeeding their children. Intensely breastfeeding their children. ठीक है, बेबी इन्फेंट को अगर उसने ब्रेस्ट फीड करा तभी होगा, एंड दिस इज ऑल्सो नॉट ए गारंटीड कि भी 6 मंथ तक होगा या नहीं होगा. सो ऑल दीज 3 मेथड्स, however none of these methods are sure method and they are required special care. Okay. Second is barrier method. As the barrier का मतलब होता है रुकावट लगाना, something which is preventing. ठीक है, what are the barriers? Now in these method generally it is available for the male and female. ठीक है, दोनों के लिए है. So यहाँ पे because of the barrier the gametes may not meet and the population like fertilization will not take place. So these are available for both and male and female. Condoms हैं, these are available for male. This is a device made up of latex which is to be worn on the penis at the time of intercourse so that the semen will be trapped in it and it will not go into the female body and it will not be able to fertilize. And the female condom, these are this type of device which is to be placed into the vagina before the intercourse so that the semen will remain trapped in it. Of course this is not a very common, but the males condoms are common. Recent years the males condoms are having an added advantage that it also prevent from sexually transmitting disease. तो advantage क्या है condom के? Prevent the unwanted childbirth. Second, since it does not let the male and female body come in direct contact, so it will prevent the sexually transmitting diseases. Third, it is easy to use, provide complete privacy. No alteration is required in the body, so anytime it can be reverted. Okay. Oral pills. Second, these are some hormonal preparation. ठीक है, generally hormonal preparation. So what it will do if it is actually taken by the ladies only, female, and this will prevent the ovulation. So when there is no ovum, what it will be, fertilization will take place. So these are the pills which is available. Most of these pills need to be taken for 21 days. These red one are for the menstrual period, and here after the menstruation completes, these pills has to be taken for next days. Okay, so this is how it has to go. Okay. Now these pills prevent ovulation and makes the uterus unhostile for the receiving zygote. Saheli is an oral pill which is developed by Central Drug Research Institute, Lucknow, India, CDRI. It is very important to describe about here that Saheli जो है, this is a drug which is a pill which is developed by CDRI India. Okay, ये क्या है, वंस इन अ वीक लेने वाला. वहाँ पे क्या रोजाना लेना था, यहाँ पे इसकी जगह क्या है, इट इज पहली बात तो ये स्टेरॉइड है ही नहीं, सो इट विल नॉट हैव दैट साइड इफेक्ट्स विच इज देयर बिकॉज ऑफ दोस पिल्स. दूसरा क्या है, ये वंस इन अ वीक लेने वाला है. ठीक है. एडवांटेज ऑफ ओरल पिल क्या है फायदा? दीज आर इजी टू यूज, डज नॉट मेक एनी अल्ट्रेशन इन द बॉडी. कोई बॉडी के अंदर कोई कट नहीं लग रहा है, कोई इंसर्जन नहीं हो रहा है, कुछ चीज प्लेस नहीं कर रही है, नथिंग. लेकिन इजी टू रिवर्ट, जिस दिन चाहें जब चाहें कि हमको नेक्स्ट मंथ बेबी चाहिए तो वो इसको डिसकंटिन्यू कर सकते हैं. प्रोवाइड कंप्लीट प्राइवेसी, कोई डॉक्टर के पास जाने की जरूरत नहीं. इट इज बेटर सजेशन ले लें, लेकिन फिर भी बार बार जाने की जरूरत नहीं. एंड सहेली इज अ नॉन स्टेरॉइड, सो इट विल प्रोवाइड दैट सेफ्टी अगेन. ओके, सो ये हो गए कॉन्डोम्स के, पिल्स के। एडवांटेज ऑफ ओरल पिल्स, सिंस मोस्ट ऑफ दीज ओरल पिल्स आर स्टेरॉयड, सॉरी डिसएडवांटेज, तो ये स्टेरॉइड्स हैं, तो दे ब्रिंग सम चेंजेस इन द बॉडी। क्या चेंजेस होते हैं? सम ऑफ दिस सीवियर केसेस लीड टू द एक्सेसिव ब्लीडिंग, देन इरेगुलर मेंस्ट्रुअल साइकिल, देन एक्सेसिव वेट गेन, एंड in some of the cases it leading to cancer even. Weight gain and cancer, these are the common thing which people have, है ना? तो these are the side effect. Okay, next is implants. Now implants क्या होते हैं? Implants are again hormonal and these are fixed in the body. See यहाँ पे, इस जगह पे, ठीक है, इसको इम्प्लांट कर देंगे, ऐसी कोई डिवाइस आती है, उससे इसको घुसा देते हैं यहाँ पे. सो इट इज इंसर्टेड इन द अंडर द स्किन, सो इट विल स्लोली डिस्चार्ज हार्मोन इन द बॉडी. तो इसके केस में क्या है, पर्सन नीड नॉट टू टेक पिल्स एवरी डे. ओके, सो देखिए, इट वर्क्स ऑन द बेसिस ऑफ सम ऑफ द प्रिंसिपल ऑफ ओरल पिल्स, बट दे कैन बी इफेक्टिव अप टू 5 years. तो एक बार लगा दो 5 साल तक है, एंड जब उसको नहीं चाहिए तो उसको निकलवा भी सकते हैं. ठीक है, इट इज लिटिल बिट पेनफुल, बट रोजाना लेने के हिसाब से इट इज बेटर. ओके, सो इफ कपल इज श्योर कि उनको नेक्स्ट 3 से 5 years तक बेबी नहीं चाहिए, तो वो ये कर सकते हैं. Unlike pills, in this case, they don't have to remember the dates and all. Okay. IUCD, intrauterine contraceptive devices. These are the devices which is T-shaped devices which is to be placed in the uterus, and ये 5 साल तक के लिए safety देती है. ठीक है. These are T-shaped devices which is to be placed in the uterus. They are of 2 type, medicated and non-medicated. Okay. Medicated में कुछ hormones वगैरह निकलते होंगे, या फिर कॉपर आयन. नॉन मेडिकेटेड सिंपल है. क्या कर रही है? मेडिकेटेड आईयूसीडी. दीज आईयूसीडी कैन आइदर रिलीज कॉपर, सो विच स्लो डाउन द मूवमेंट ऑफ द स्पर्म्स. तो स्पर्म वहां तक, ओवरी तक, अंडे तक पहुंचते पहुंचते मरी जाते हैं. दे डाई बिफोर रीचिंग टू एग. ठीक है. एंड द कॉपर रिलीजिंग आईयूसीडी आर CUT, दैट इज कॉपर टी, CU7 एंड मल्टीलोड. तो एग्जाम्पल से याद रखना, CUT and CU7 and multiload are copper releasing. Okay, on the other hand we have got hormonal one which are releasing hormone progesterone, तो इसको कहेंगे progestat, and LNG20, so they are releasing progesterone. So what happens, they make a thick discharge of the mucus at the cervix, so cervix को गाढ़ा कर देंगे, so the sperm may find difficult to enter. Okay, movement of the sperm, and they will kill the sperms even. Spermicidal भी हो सकते हैं. The progesterone releasing IUCD secretes thick mucus at the cervix, which make the difficult for sperm to enter. Okay, IUCD is a better method in compared to the pills. Okay, so all kind of IUCD makes uterus unhostile for the receiving and implantation of the embryo, क्योंकि वो एम्ब्रियो के अंदर ही लग गए, तो ये उसके लिए जगह ही प्रोवाइड नहीं करते हैं कि वो यूट्रस में आके लग जाए. एडवांटेज ऑफ आईयूसीडी, दीज डिवाइसेस शोज लीस्ट साइड इफेक्ट्स, दे प्रोवाइड लॉन्ग कॉन्ट्रासेप्टिव अप टू 5 years. Then these are good choice for those couples which want to create a gap between the two child, or they want to have their first baby after 3 to 4 or 2 to 5 years, whatever. So whenever they want, they can implant it, and whenever they want, they can remove it. ठीक है. सो दिस इज अ बेटर मेथड टू प्लान ए फैमिली, कि उनको अपना बच्चा कब कब चाहिए. ठीक है, ये हो गया. डिसएडवांटेज कि इसमें भी क्योंकि फॉरेन ऑब्जेक्ट रखा है, तो सम टाइप ऑफ इन्फ्लेमेशन, सम टाइप ऑफ इरिटेशन विल बी देयर. समटाइम इट मे लीड टू द abnormality in the menstrual cycle, breakthrough bleeding and all can be there. ठीक है. Okay, the last one is surgical method. Surgical method, as you know, some surgery, some alteration is to be required in the body, and generally it is called terminal method. इसको revert करना मुश्किल हो जाएगा. तो this method, the duct carrying gametes are blocked or cut. ठीक है. Now surgically blocked, वो पूरा sentence नहीं है. This method is available for both male and female. In male, vas deferens is cut, so it is called vasectomy. In female, the fallopian tube is cut, so it is called tubectomy. Okay, vasectomy and tubectomy. In males, ये है vasectomy. This is the scrotum testis. तो ये scrotum में, so there is a fine small hole is made in that scrotum, and with a loop type of device, the seminal vesicle is pulled out, its end are tied and cut so that the sperm which are produced here will not be able to go ahead, and here there will be no sperm. The both side it has to be done. तो इससे क्या आगे sperm बाहर ही नहीं आएंगे. And if the sperm is not coming, so how the fertilization? But semen will be discharged because the semen is a production of seminal vesicle and prostate. Okay, but the semen will not contain sperms in it. Okay, so that is vasectomy. And due to separation of these two ends, the sperm will not be released. Tubectomy के अंदर क्या हो रहा है? The fallopian tube. This is the fallopian tube which is connecting to uterus. This is the fallopian tube which is connecting to uterus. So anywhere between this to this or this to this, they have to be cut both side. Okay. तो pelvic region में छोटा छोटा सा इंसर्जन लगेगा और फिर उसको fallopian tube को बांध के काट देंगे और काट के बांध देंगे जो भी है, so that the sperm which has come from here will not be able to reach there, egg will not be able to reach here. वैसे भी egg तो क्या 2 दिन ही जिंदा रहेगा तो वो यहीं पे मर जाएगा. The sperm will not be able to reach there. So this now both these methods, vasectomy and tubectomy, are terminal method. एक बार कर दिया उसके बाद उसको restore करा तो जा सकता है. It is possible, but it is expensive, it is time consuming, it is a tedious process. ठीक है. So only those couple who don't want to use any of the other contraceptive devices but they want to maintain population size, or they don't want unwanted child, then they can go for this, but they have to be very careful. इसके बाद इसको restore करना थोड़ा typical रहेगा. ठीक है. तो ये final process है. Advantage of surgical method, these are terminal methods. These methods can be effectively throughout life. ठीक है. Function in any way and not be physical problem to any of the person. Disadvantage क्या है? Since these are terminal method, तो इसको restore करना मुश्किल है. And surgical method, some type of mental tension is always there. Need of contraceptive. Do person always need contraception? No. A couple doesn't require to use contraception at all. Contraception is required for these reasons. किस के लिए? किस चीज के लिए उनको कॉन्ट्रासेप्शन की जरूरत है? इफ दे वांट टू मेंटेन डिस्टेंस बिटवीन चिल्ड्रन, दे डोंट वांट एनी मोर चिल्ड्रन टू बी एडेड, एंड दे वांट मेंटेनिंग फैमिली. ठीक है. देन condoms are used even to prevent against STDs, and whenever there is a danger for the survival of a pregnant woman or child, पहले से डॉक्टर ने बोल दिया कि भाई अब नेक्स्ट चाइल्ड तुम्हारा खतरनाक हो सकता है, then it is better that the mother should use this. ठीक है. 4 reasons which they don't require another baby. Then secondly, they want to create a distance between first and second child. Thirdly, they want to prevent against STDs. Fourthly, when it is a dangerous situation for either mother or to the infant. Okay. Last is MTP. Now MTP, one must remember that it is not a method of contraception. It should not be practiced, or it should not be interchanged or exchanged by contraception. MTP is, that is medical termination of pregnancy. Forcefully the child, the embryo or the zygote is removed from the uterus. Government of India legalized MTP in 1971. दुनिया में ऐसी कई सारी कंट्रीज है जहां आज तक ये लीगलाइज नहीं हुआ, इंक्लूडिंग यूएसए. ठीक है. बट इंडिया ने कर दिया इसको. ठीक है. बट उसके लिए कुछ कंडीशन बांधी है. क्या है कंडीशन? ड्यू टू अनप्रोटेक्टेड सेक्स और ड्यू टू फेलियर ऑफ द कॉन्ट्रासेप्टिव डिवाइस. उसने कॉन्डोम यूज करा बट वो रप्चर हो गया, और उसने सर्जरी कराई बट वो फेल हो गई. ठीक है. और सेकंड, प्रेगनेंसी इज ड्यू टू रेप. ठीक है. थर्डली, whenever there is a danger of survival of pregnancy to the mother or to the infant or to the both, then they can think of this method. So one must remember that it is not a method of population control. कब कराएंगे? When MTP, one of the danger of MTP is that the people are using it for female feticide. और कहाँ पे कराना? Only to the registered medical practitioner, not to the quacks. वापस से वो कई सारी प्रॉब्लम ला सकता है. Hence government of India passed a resolution that MTP for the female feticide is a punishable offense. अगर फीमेल बच्चा पता करा पहले सेक्स और उसके बाद उसको गिराया तो वो है. Testing of and detection of the sex for unborn child is also a punishable offense. और उसकी तो बहुत बढ़िया पनिशमेंट है. राइट टाइम कौन सा है MTP का? पहले 3 महीने का फर्स्ट ट्राइमेस्टर, उसके बाद कराने पे खतरा हो सकता है, ठीक है। तो दीज आर द पॉइंट्स ऑफ द एमटीपी। सो दैट्स ऑल। अब इस जब मैंने ये वीडियो बहुत शॉर्ट में बनाई है, जल्दी में बनाई है, तो आप इसको देख लें। इफ इन केस ऑफ एनी डाउट यू कैन ऑलवेज आस्क मी, दिस इज ओनली रिलेटेड टू द चैप्टर। सो क्वेश्चन अगर आप मुझसे पूछ रहे हैं तो चैप्टर से रिलेटेड ही पूछें। आई एम नॉट ए डॉक्टर टू सजेस्ट यू समथिंग, है ना। काइंडली शेयर दिस वीडियो विद द अदर्स, एटलीस्ट प्राइमरी नॉलेज तो हो ही जाएगी। डू यू लाइक दिस वीडियो? then please like it, do like the video and subscribe the channel if you are new। और जिनने कर रखा है well and good, और वो घंटी है ना उसको भी दबा दें। और अगर आप सब्सक्राइब करेंगे तो मुझे भी फ़ायदा है और आपको भी फ़ायदा है। आपको फ़ायदा ये है कि आपको इन्फॉर्मेशन मिलती रहेगी, मुझे भी फ़ायदा ये है कि मेरा एक सब्सक्राइबर जुड़ जाएगा, ठीक है। सो मैं आपसे यही अपेक्षा करता हूँ कि आप मेरे लिए चैनल को सब्सक्राइब कर दें और वो घंटी दबा दें, और जब भी वीडियो आए देख लें। दैट्स ऑल। Your problems are invited and I am always there to answer them. Thank you.